Balanced news in high definition. The FOX19 Weekend Morning News.
Hey, thank you so much, Katie. We have some health information for you this morning. More than 500,000 men have vasectomies every year. So what's involved? How long does the recovery take? All of those questions you're probably asking yourself. This morning we have Dr. Kevin Campbell of the Urology Group with us. Thank you for braving the weather to come down.
Thanks, Dan.
Talk to us about vasectomies. I think men have a lot of questions. I think women are interested by the topic. So as far as it goes, how many people are you seeing that go through this procedure in the tri-state? Thousands, I would assume.
It's one of the most common procedures by urologists all over the country, and especially with our group. I think once a man and a couple are sure they don't want any more children, a vasectomy is a simple procedure done in the office that virtually eliminates the concern about maybe an unwanted pregnancy down the future, and hopefully then increases intimacy with your partner.
With that said, I think guys out there are worried about it or have a lot of concerns about it. That's really unfounded, right? I mean, it's safe, it's simple, 20 minutes in and out, and there's a bit of a recovery time.
Every man, including myself, I had a vasectomy 17 years ago, has apprehension before a vasectomy. Almost everybody says, gee, that was no big deal. You're right, it takes about 20 minutes. We do it with just a little numbing medication. Of the 20 minutes, 19 of those minutes would be you and I just talking to, and really very minimal recovery. I had a vasectomy, as I said, on Friday evening. I had 3 small children on Saturday, went to the pool. Saturday night I went to a party, and I played golf on Sunday. So very, very simple, easy procedure done in the office with minimal recovery.
Good information, and I think it's important to also note that you as a patient, or me as a patient, would talk to you as my doctor well before this ever got to that point. You again need to figure out if this is the right scenario for you.
Exactly. The first thing I ask people is, or tell to people, if you're pretty sure you don't want any more children, don't have a vasectomy. It's a great form of birth control, just not a good temporary form of birth control.
Doc, are we seeing more of it nowadays?
I'm not sure if we see more of it because we've always done a lot of vasectomies. It's, again, I've been in practice for 20 years and have done over 2,500 vasectomies. So I would say a urologist typically will do, 50 to 100 vasectomies or more a year. So I don't know that it's any more prevalent than it has been over the last 20 years. It really started becoming very popular after World War II, and it's, really because of its simplicity, I think, is continues to be very common.
Last point, and then we need to wrap up, but the cost if you don't have insurance, and does insurance typically cover it?
Yes. I would say if you don't have insurance, the cost would be around $700.
Okay.
And fortunately, almost all insurances cover it, because when you compare it to maybe other forms of birth control and certainly having further children, it's obviously very, very cost effective.
A good discussion to have. Thank you for coming in today.
Sure.
Appreciate it, Doc. Of course, we're going to have all the latest information on that on our website at FOX19.com. When we come